think Dr. Gafar and both Chika, who are, both we work together in the same sector, have really set the scene on the challenges, while Dr. Gafar kind of laid the groundwork on the funding. I think what Chika did, and I hope everybody keys into what she said, is the human cost of the pause in funding, without going into, the background detail. But what we know, especially in the area of HIV, is Nigeria has about 2 million adults and children who are currently HIV positive. And of those, about 1.7 million are receiving ART, antiretroviral, which is what Chika alluded to. So this sudden pausing in funding absolutely was not ideal. The suddenness of it, I think, really caught everybody, not just in Nigeria, but globally, kind of just really caught people by surprise. But we all understand, and we all have seen it over the last couple of years, 10 years plus, that geopolitics is increasingly affecting how countries decide to fund foreign aid. Post-Brexit, we saw the same thing with UK funding decrease from the usual 0.7%, which was ring-fenced, to 0.5%. So what we're seeing is geopolitics is affecting the way countries now see the strategic priority of foreign aid, which brings us to Nigeria. It is very unfortunate that for decades, we as a country have been so dependent on foreign aid to fund our health sector. The vulnerability we are seeing now, and that vulnerability is going to see collateral damage in people, lives lost, children, mothers. US funding is probably the largest funder for many health programs globally. I mean, in the last fiscal year, they gave about $767 million to Nigeria. The vast majority of it, about 322 million, was for HIV, with about 292 for emergency responses and 112 for maternal health. So we see how we have been so dependent on foreign aid to fund our health sector. And I think this is a wake-up call. In the media, of course, we saw that the government has now allocated 4.8 billion for HIV treatment. But this is not funding that's going to come immediately. And the acute phase is now. And what we are going to see are a lot of programs that were receiving funding, maternal health programs, immunization, HIV especially. People who are at the grassroots, people who are on the receiving end and are dependent on these funds are going to suffer for it. The government, yes, we have seen them snap into action very quickly with more funding suddenly allocated to health. Nigeria Health Watch is one of the many advocacy organizations. For many years, we have been advocating for more domestic resource mobilization for our health sector. I mean, we named a few: HIV, maternal health, immunization, but us also think about sexual reproductive health. We're also dependent on foreign aid for our commodities. So as a country, I think now is really the time for us to collectively realize, and for Nigerians themselves to start asking questions. We don't ask enough questions. We've just seen that the budget has been passed, 57 trillion. How many Nigerians are going to now look and see how is that funding going to be used? We see infrastructure given a lot of priority. Not to say that we don't need infrastructure in the country. It's great that we need it for economic growth of the country. But how are we investing in our health sector? How are we investing in education? All of those other human capital development initiatives that lead us as a country to economic prosperity. So in the immediate, the freeze on foreign aid from the US, it's their prerogative. These are US taxpayer dollars. But how are we ourselves as a country asking questions and demanding that health is prioritized? One of the presenters mentioned the death in Lassa fever. We've had Lassa fever in Nigeria for over 50 years. Until now, we don't have a viable vaccine. And each year, we're almost desensitized to the early warnings when, in January, February, March, the acute phase of Lassa, every single year, we're reporting deaths every time. But we don't really push our local councillors, our local government, and our governors. How are they prioritizing health? And ultimately, I think this is the time for all Nigerians to really start stepping up and asking, why are we not spending enough on health? And this is really the time when we see funding suddenly being reduced. People are now realizing that we've been so dependent on foreign aid till now. So just to say that if any time this is a wake-up call and a very painful one because of the deaths that will result in people not receiving treatment, etc. But I think we really need, as advocates, as media, to really start elevating health in the discussions we have on a daily basis.
Thanks, Vivian. You spoke about asking questions. I think that would be a long-term solution to this problem. When you ask the questions, you hope to get answers. I mean, that will take a long time. But how do we deal with this, in the immediate? Because you just raised another concern. I wasn't looking at that initially. I mean, the focus has also been HIV, malaria, tuberculosis, immunization. That's critical. I mean, with the support we're getting, I mean, we know what the statistics, say as regards children who still develop some childhood illnesses, and what the statistics is for child death, children between birth and 5 years. So tell us, what do we do now, just now, this minute, just so that we can prevent some of these deaths and, if you like, some complications that may result from this?
We need emergency funding. Where are the gaps that the foreign aid was filling before that we as a country now need to fill? Part of that budget should absolutely go to these emergency programs to save people's lives. So the simple answer is we need to see where those funding gaps are and plug them immediately, because the cost of that will be lives lost. I mean, just to reiterate, mentioning immunization, one of the main ways we get our immunization is through Gavi, the Global Alliance for Vaccines and Immunization. And recently, the UK government mentioned that they were going to do, in the next financial year, they were going to review the funding that they allocate to Gavi. And this is based on the broadened priorities in the UK. So even Gavi, that is a key source of funding, it's a key source of Nigeria getting its vaccines. The UK is already mentioning that in the next fiscal year, they may cut back as part of their wider spending review. So to your question, what needs to be done immediately? I think it's not just actually the national government. We also need to look, because health is really local. So our state governors, who really, as a federated country, have a purview over health sector as well. How are state governments plugging some of these funding gaps? If we look at immunization coverage, I'm using immunization really as a proxy for some of the bigger issues we have. We look at our immunization rates across the country. It varies from some states having vaccine rates of over 10%, to some having as low as 10%, to some having as high as 70+%. We look at polio. Whilst we celebrated that in 2020, while polio virus was eradicated in Nigeria, we currently still have cases of circulating vaccine-derived polio virus, which is an urgent need and a big concern. And we mentioned USAID. There are many other funders that have allocated a lot of money to some of these interventions. For example, the Gates Foundation have allocated over 47 million globally to eradication of polio. And in Nigeria, they've spent significant amounts of money in polio eradication. But we still have cases of children who are still not immunized. So this still goes back. In the immediate, we need emergency funding to plug the gaps. But in the medium to longer term, we absolutely, as Dr. Ghaffar mentioned, domestic resources need to be allocated to health. We know that we do have many competing priorities in the country, and the cake is not getting any bigger, but we need to grow the cake in terms of how much money the country is generating, but also look carefully at where are we allocating funds that we could now use for the health sector. Because if you have an unhealthy population, all these other things we're looking to fund, it turns to nothing. So really, absolutely, we need urgent domestic resources for health, and longer term, we need to really think carefully, how are we prioritizing Nigerians.